Hello, my name's Chris Bonell. I'm a Professor of Sociology and Social Policy at the Institute of Education. I want to talk about an editorial that I, together with some colleagues, wrote in the British Medical Journal, which is about current UK policy on education, and how in some ways this is inadvertently undermining the health of young people in the UK. So currently we argue that education policy in England neglects health and well-being. There are league tables which are widely used by parents in the UK on deciding where to send their kids, and which are used by the government to monitor the performance of schools. But these league tables focus exclusively and very narrowly on educational attainment and don't provide much information about how the schools promote the health and well-being of the young people who are within them. So that's one way that schools' minds are focused very narrowly on educational attainment and on not much else. Another important development is that there used to be a national healthy schools programme in the UK, which was nationally funded, had a national office controlling it and encouraging it, but this is now being denationalised. Although some areas do deliver healthy schools programmes, there's no national funding and no national direction. So this movement has sort of lost impetus, and this means that an awful lot of health work that might be happening in schools is no longer happening. And finally, there is something called personal, social and health education, PSHE, in schools, which is where health education and citizenship education, etc., is delivered. There used to be a sort of dedicated slot for this in most school timetables, and schools are required to teach it. But because schools are so focused on making sure that they improve their league table position, they're cutting to the bone any provision that's not really going to sort of help them in that mission. So an awful lot of PSHE provision is getting marginalised. Schools are spending less and less time teaching it. Surveys of schools have established this. And in our editorial, we questioned whether these developments whereby health is getting marginalised in schools might be underpinned by two ideas which we think are flawed ideas. The first big idea we think that is happening is that policymakers think that promoting attainment on the one hand and promoting students' health on the other hand is a zero-sum game. In other words, you can't focus attention on both. You have to focus on one in order to improve attainment. And if you started focusing on health as well, that would undercut schools' ability to maximise attainment. We think that's flawed. I'll explain why in a minute. The second big idea, which we think is governing policy, which we think is wrong, is there is a belief that improving educational attainment alone is sufficient to increase economic competitiveness. And again, we think this idea is wrong. So in terms of the zero-sum game ideas, there are a number of reasons why we think this zero-sum game argument is incorrect. First of all, there's very good evidence from a large number of research studies that students who are in better health achieve better academically. Secondly, there's evidence that student progress in education and their progress in terms of their broader personal development and well-being actually interact over time if you look at child development studies. And thirdly, schools where students do better than expected academically also do better than expected in terms of health. So there appears to be a synergy between these two domains of health and education rather than some kind of competitiveness between them. Other evidence that there's not a zero-sum game is that education systems where there's more emphasis on personal development and health and well-being often do a lot better in terms of educational attainment than we do. If you think about the studies that always get flagged up in the newspapers because they've done very well in international comparisons of education, countries like Finland, Sweden, Australia and even Singapore, these countries actually do focus quite a lot on students' well-being and health and succeed in doing this without neglecting their educational attainment. But for us, the real clincher in terms of evidence is that there's really strong experimental evidence from randomised control trials that where you deliver interventions that address the physical and mental health of students in schools, these also have knock-on consequences, not only for students' health, but for student academic attainment as well. There are 3 systematic reviews of studies done in America which establish this pretty much conclusively. So our argument then is that addressing health should actually help schools maximise kids' attainment rather than undermining that, so there's not a zero-sum game. The second argument that we want to suggest is flawed is that attainment is all that matters in terms of economics and economic competitiveness. The reason why we think this is flawed is simply because there's so much evidence internationally that an effective labour force doesn't just need to have cognitive skills and strong academic skills, but an effective labour force needs to have soft skills such as resilience and teamwork skills, which can't be provided in academic curriculum. They're more likely to be provided in lessons such as PSHE, personal, social and health education. And there's also strong evidence that the productivity of workers is improved by them being in better health. And the best way of ensuring that adults are in good health is to make sure that they learn healthy behaviours while they're still at school. So what we're arguing for is a balanced approach, and an approach that recognises the synergy between health and education. Of course, schools need to teach students academic knowledge and cognitive skills. Anyone who sends their kids to school wants them to learn. But our argument is that schools can achieve that end, but they can also ensure that they're achieving a wider, more holistic goal of preparing students for adult life in other ways, and ensuring that students are happy and content in their current lives as kids. So, and to do that, they need to teach students personal skills, learn about healthy behaviours, and ensure their mental and physical well-being. And the question is, how can schools do that? In another one of these talks, I've talked about health promoting schools interventions. And the evidence now is very strong that health promoting school interventions offer a pragmatic, practical and effective means for schools to promote the health, the mental and the physical health of students in schools. But for schools to be able to do these things, to deliver health promoting schools interventions and to deliver good health education in PSHE slots, requires a number of changes really in policy. And the policy changes we would recommend would be that PSHE, personal, social and health education, becomes a statutory subject which is part of the national curriculum, which isn't the case at the moment, which suggests that there needs to be more emphasis in Ofsted inspections where schools are inspected by external people. There needs to be more emphasis on how the schools promote health and well-being. Ofsted inspectors already do promote health and well-being, but having talked to Ofsted inspectors in the field, it's very clear that their assessments of how schools are doing in terms of health almost never have an impact on whether a school passes or fails an inspection. So we think they need to have much more salience in inspectors' minds and in the criteria of judgment for schools. We would also argue that league tables should embrace well-being as well as academic attainment, and it would be really useful for parents to be able to have league table information about how schools in their area are doing in terms of rates of bullying, in terms of mental well-being and a sense of belonging in school. And in fact, the international organisation that looks at education in different countries, PISA, is starting to introduce this internationally. So really Britain needs to get with the programme and start thinking about doing this in its own schools. And finally, we'd recommend a resurrection of the National Healthy Schools programme. But within this, we'd recommend that the National Healthy Schools programme really needs to focus on programmes where there is strong evidence of effectiveness. Sometimes the National Healthy Schools programme validated schools in doing a range of practices, some of which were effective, some of which weren't effective. And we'd strongly recommend that if it was resurrected, the programme should really focus on encouraging schools to implement evidence-based programmes.